one of the things they don't tell you at medical school is that your job is going to be to change people's behavior. Um, and I was chatting to Dr. Dylan Gibson the other day, one of my colleagues, and he, we were chatting about behavior change and that it is actually an art, not a science. And if your doctor has said to you before, take this pill or you're going to die, then that is probably not true. And you can probably tell your doctor, if they tell you next time that if you don't do something, you're going to die, you can say, that's not true. The truth is that I have an increased risk of dying, but I'm not going to die, because nobody knows that. So the job of a GP is to wield the truth. And sometimes we do it well, sometimes we don't do it well. So truth is in essence science, and so the job, or the job description, is to change people's lifestyles in accordance with the science. So the interesting journey I've had in this art of changing people's behavior is that truth needs a good measure of grace in it to be effective. And I love the analogy that I heard from a good friend of mine, Dave Pedersen, that grace is like the anesthetist and truth is like the surgeon. And so you need both. If someone came to you, even if they were a doctor, and they said, listen, you've got a cancer, we need to cut it out, please lie down, I know exactly where it is, I can do this, I've done it a million times, I'm an expert, and you just need to hold still. I don't think that would work, would it? Although they did do that in the olden days, but yeah, let's not go there. So you need the anesthetist and the surgeon. And so with the truth, you need some grace. And the grace is what in ethics we like to call free will, or autonomy. So as a GP, we present the facts as best as we can. And to be honest, a lot of facts that we thought were facts are no longer facts, like eggs are bad. So don't believe everything that your doctor says to you. Go do your own research. Yes, Google is fine if you are asking it a specific question. And do not ask Google what your diagnosis is, because you'll always get the worst diagnosis because it gets the most hits. But where was I? Yes, so present the facts with respect for a person's autonomy. So you got the grace, or you got you got the truth, and you got the grace. So in my experience, I've had a number of people who've come to me for the first time, and I take a history, and in the history I ask them, are you smoking? Do you smoke? And they say to me, yes, I smoke. And then they get ready for the next question, or they get ready for, why do you smoke? You should stop smoking, stop doing that, you're gonna die. And I just move on. I don't say anything. I just say, do you smoke? And they say yes. And I just say, how many cigarettes a day? Okay. When did you first start smoking? Okay. And then I move on. And I think it surprises some people. But then, lo and behold, some people have come to me a few weeks later or a few months later, and with the reason for their visit being, I want to quit smoking. So there's some of those facts that we all know, and some truth that we all know. You don't have to go to a doctor to nowadays to know that smoking is bad for you. But yeah, so that's a little bit about the art of medicine and the art of being a good GP.